Welcome to Medigap TV. Real answers about Medicare in plain English. If you live in Wisconsin and you're turning 65 or you're about to retire and come off an employer plan, this video is specifically for you. Wisconsin handles Medicare supplements differently than the rest of the country. And if you don't understand how it works here, you can end up with the wrong coverage or pay more than you need to. My name is Loran Marms, and I've been helping people navigate Medicare for 16 years across 46 states, including right here in Wisconsin. Today, we're going to break down everything you need to know from the basics of Medicare all the way through Wisconsin's unique supplement structure. And by the end of this video, you're going to know exactly what your options are and what your next step should be. Here is exactly what we are going to go through today. We're going to start with how and when to sign up for Medicare, because the timing matters more than most people realize. And a mistake here can cost you for the rest of your life. Then we're going to get into Wisconsin's unique plan structure, which is different from every other state in the country. So if you've been watching other Medicare videos, a lot of what you've heard does not apply here the same way. After that, we'll walk through your two coverage paths and what they actually cost. And then we'll finish with Part D drug coverage and the late enrollment penalty, which is something too many people skip and end up regretting for years. Let's get into it. Medicare has 4 parts, but only 2 of them come directly from the federal government. Part A is your hospital coverage and Part B is your doctor and outpatient coverage. And those two together are what most people mean when they say Medicare. Part C and D are different because they come from private insurance companies rather than the government. Part C is Medicare Advantage, which is an alternative to original Medicare that we'll talk about in detail, and Part D covers your prescription drugs. When we talk about filling the gaps in your Medicare coverage, we're talking about working around what Parts A and B leave behind, and there is quite a bit that they leave behind. Here is where a lot of people get a surprise, because original Medicare does not cover everything, and what it leaves behind can add up very fast. Your Part A hospital coverage comes with a deductible of $1,736 per benefit period, and that deductible resets every benefit period, which is 90 days, so it can hit more than once in a single year if you have multiple hospital stays. But the bigger issue for most people is the 20% co-insurance that original Medicare assigns to both Part A and Part B. Once you've met your deductibles, you owe 20% of every approved medical cost for both your hospital bills and your doctor bills, and there is no ceiling on that number. There is no maximum out of pocket on original Medicare alone. So a $100,000 medical event means $20,000 comes straight out of your pocket, and a $200,000 event means $40,000. That is the gap, and that is exactly what a Medicare supplement is designed to cover. Before you do anything else, before you call anyone, before you start comparing plans, go to ssa.gov and create your account if you don't have one already. SSA.gov is the official Social Security Administration website, so make sure you're on the .gov version, not a .com, because there are sites out there that charge you for things you can do for free. Creating your account is the only way to track your Medicare application once you submit it. If you apply by phone or go in person to a Social Security office, you have no way to see where your application stands. But with the online account, you can log in and check your status in real time. And this account isn't just for Medicare. You're going to use this same SSA.gov account for the rest of your life to check your Social Security benefit estimates, update your banking information when you're on Social Security, pull your annual tax forms, and manage your benefits whenever something changes. Set it up first. Everything else is easier once you have it. The most important thing to understand about Medicare timing is this. Everything Medicare starts on the first of the month. There are no mid-month start dates, no exceptions, and no workarounds. If you're turning 65, you want to apply about 90 days before the first of the month you turn 65, so your coverage is active and your card arrives before day 1. And if you're retiring off a group plan, the same rule applies. Apply 90 days before the first of the month your group coverage ends, so there is no gap between your employer plan ending and Medicare starting. One more thing on timing that a lot of people don't account for. The SSA.gov processing time runs 6 to 8 weeks. So if you wait until the last month before your coverage needs to start, you are cutting it very close. Apply early, create your account, and track the status online so you're not left guessing. If you're still working at 65 and covered by your employer's health plan, the most important number you need to know is 20. If your employer has 20 or more employees, your group plan stays primary and Medicare becomes secondary, which means you can delay enrolling in Part B without any penalty until you or your spouse actually retires. However, if your employer has fewer than 20 employees, the rules flip completely. Medicare becomes your primary coverage on your 65th birthday, even if you're still actively working. And you need to enroll in both Parts A and B right away, or you'll have a gap in coverage. If you're in that larger employer situation and you're thinking about delaying Part B, I want you to do one thing before you decide. Do the math first. Compare what your group plan is actually costing you in premiums each month, what the deductible is, and the maximum out of pocket against what Medicare plus a good supplement would cost. Sometimes the group plan isn't nearly as good of a deal as it looks, especially if your employer's contribution is small. And making the switch at 65 can actually save you money. When you're ready to retire and come off your employer plan, there are 3 steps you need to take, and the order matters. Step 1 is to go to SSA.gov and start your Medicare enrollment process. As part of that process, SSA will walk you through getting a form called the L564, which your employer fills out and signs to confirm you had credible employer coverage during your working years. Step 2 is timing. Apply about 90 days before the first of the month your group coverage ends. There is no grace period after your employer plan stops. So if your Medicare isn't active when that plan ends, you are uninsured, even if it's just for a short time. Step 3 is the one people most often skip, and it's about your Medigap enrollment. Your 6-month Medigap open enrollment window opens the moment Part B starts, and you want to use that window right away. If you wait and come back to it later, once that window is closed, you may have to go through full medical underwriting to get a supplement, which means a carrier can decline you or charge you more based on your health history. Use the window when it's open. Once you have original Medicare in place, you have 2 paths to fill those gaps we talked about. Path 1 is a Medicare supplement, which most people call Medigap. This is private insurance that works alongside original Medicare. With a supplement, you can see any doctor anywhere in the country who accepts Medicare. There are no networks, no referrals required, and no prior authorizations needed for care. Path 2 is Medicare Advantage, also called Part C. Instead of working alongside Medicare, Advantage plans replace original Medicare with a private health plan. These plans often have lower or even $0 monthly premiums, but they come with provider networks, copays, prior authorization requirements, and out-of-pocket costs that can add up in a year where you use your coverage heavily. We sell both types of coverage at Medicare Solutions team, and our job is not to steer you one way or the other. Our job is to help you figure out which path actually fits your situation, your doctors, and your budget. Let me walk you through exactly how a Medicare supplement works, because a lot of people aren't quite sure. When you go to the doctor or the hospital, Medicare processes the claim first and pays its share. Then your supplement automatically pays its portion directly to the provider behind the scenes. You never see the bill. You don't have to file a claim yourself. And with the right supplement, most visits cost you nothing out of pocket. The other thing that surprises people is how broadly supplements work, because they're tied to your Medicare membership and not to a network. They work with any doctor or hospital anywhere in the country that accepts Medicare, whether you're in Green Bay, visiting family in Arizona, or spending the winter in Florida. And one more thing worth knowing, by federal law, every insurance company is required to offer the same standardized benefits on each plan type. What that means for you is that the coverage itself is identical, no matter which company you choose. The only real variable between carriers is the monthly premium and how stable that premium is over time. Medicare Advantage works differently than a supplement, and there are a few things you really need to understand before choosing one. First, these plans are built around provider networks. You need to use doctors and hospitals that are inside the plan's approved network. And going out of network often costs significantly more, or in some cases isn't covered at all, outside of a true emergency. Second, even on a plan that advertises a $0 premium, you are still paying the Part B premium every single month to Medicare. That $202.90 does not go away, so the real cost of a $0 Advantage plan is at least $202.90 per month before any copays or coinsurance. Third, your out-of-pocket costs can add up quickly in a year when you use your coverage heavily. And while every Advantage plan has a federal out-of-pocket maximum, and that maximum in 2026 is set at $9,250, but that is the maximum allowed, with many plans having a lower max out-of-pocket. It really depends on the plans in your area. Either way, that is a significant exposure if you have a serious health event. Here is where Wisconsin gets interesting and where a lot of residents get confused, especially if they've been watching general Medicare content online. When you hear people talking about Plan G, Plan N, Plan F, or any other lettered plan, those are the plan types used in the other 47 states. Wisconsin is one of only 3 states in the entire country that does not use that system, along with Minnesota and Massachusetts. Instead of lettered plans, Wisconsin uses what's called a base plan combined with optional riders that you add on top of it. Every insurance company in Wisconsin sells the same base plan, and then you choose which riders to stack on top of that base to build the level of coverage you want. The good news is that the right combination of riders gets you to coverage that's equivalent to a national Plan G or Plan N. It's just assembled differently here. Once you understand the structure, it's actually pretty straightforward. So what does the base plan actually cover? One thing and one thing only. The Wisconsin base plan covers your Part A and Part B coinsurance, which is that 20% share that original Medicare assigns to both your hospital bills and your doctor bills. That's the core job of the base plan. What the base plan does not cover is important to understand. It does not cover your Part A hospital deductible. It does not cover Part B excess charges from doctors who don't accept Medicare assignment. It does not cover additional home health visits, and it does not cover emergency care when you're traveling outside the United States. All of those require you to add a rider. One more thing worth knowing here. There used to be a Part B deductible rider you could add to cover that $283 annual deductible, but that rider was closed to anyone who became eligible for Medicare after January 1st of 2020. If you're new to Medicare now, you can't get it. So the Part B deductible is something you'll pay out of pocket each year on a supplement anywhere in the country. The riders are what turn the basic base plan into a full supplement, and there are 4 main ones to know about. The Part A deductible rider covers that $1,736 deductible per benefit period, so you don't have to pay it out of pocket when you're hospitalized. The Part B excess charge rider covers the extra 15% that doctors who don't accept Medicare assignment are allowed to charge above Medicare's approved rate. Most doctors do accept Medicare assignment, but this rider makes sure you're protected either way. The home health rider adds 40 additional home health care visits per year on top of what Medicare already covers, which matters if you ever need extended in-home care after a hospitalization or surgery. And the foreign travel emergency rider covers 80% of your emergency medical costs when you're outside the United States. After a $250 deductible, it covers 80% up to a $50,000 lifetime maximum. You add the riders you need, skip the ones that don't apply to your situation, and build the coverage level that makes sense for you. If you want the coverage equivalent to what is called Plan G in other states, here is exactly how you build it in Wisconsin. You start with the base plan, which gives you the co-insurance coverage for both Part A and Part B, and then you add 4 riders on top of it. You add the home health rider, the Part A deductible rider, the Part B excess charge rider, and the foreign travel emergency rider, which covers 80% of emergency care abroad after a $250 deductible up to a $50,000 lifetime maximum. That combination of the base plan plus those 4 riders is your Wisconsin Plan G equivalent, and it gives you the same protection that Plan G provides in any other state. Most approved medical costs for both Part A and Part B are covered. The hospital deductible is covered, excess charges are covered, and you have travel protection. At age 65, the Plan G equivalent typically runs somewhere between $125 and $200 per month in Wisconsin, depending on the carrier and where you live. And we'll show you every rate available in your area when we talk. If you're looking for something with a lower monthly premium and you don't mind a small copay per office visit, the Plan N equivalent is worth understanding. Adding the Part B coinsurance rider to the base plan, which is what creates the Plan N structure, drops your monthly premium, but introduces a copay of up to $20 per office visit and up to $50 for emergency room visits. You would still keep the other riders from the Plan G type setup. Your Part A deductible is still covered with the Part A deductible rider. Your hospital coverage is still 100%, and the base plan is still covering the coinsurance on both Part A and Part B. Here is something unique to Wisconsin that doesn't exist anywhere else. On the national Plan N, you have no protection against Part B excess charges. But here in Wisconsin, you can actually add the Part B excess charge rider to your Plan N equivalent if you want it. That option doesn't exist in other states, which gives Wisconsin residents more flexibility in how they build their coverage. At age 65, the Plan N equivalent typically runs somewhere between $80 and $130 per month. So the premium savings compared to the Plan G equivalent can be meaningful if you don't visit the doctor frequently. You also need to look forward to when those rate increases happen. You are starting $40 to $70 per month lower. So when those rate increases happen, you aren't hit as hard. Let me put the two side by side so you can see the difference clearly. On both plans, you pay the Part B deductible yourself, which is $283 in 2026. That's true for both the Plan G and Plan N equivalent. Hospital coverage is 100% on both because both include the Part A deductible rider. The real difference comes down to two things: office visit copays and monthly premium. On the Plan G equivalent, there is no copay when you go to the doctor. On the Plan N equivalent, you pay up to $20 per visit. In exchange for that copay, the Plan N equivalent costs less per month. So the decision really comes down to this: how often do you go to the doctor? If you have several specialist appointments each month, those $20 copays can eat up the premium difference quickly, and the Plan G equivalent might save you money overall. If you're generally healthy and go to the doctor only a few times a year, the Plan N equivalent's lower premium might come out ahead. There's no universally right answer. When we sit down together on the call, we'll run through the math for your specific situation. Before we move on, I want to share 3 things that every Wisconsin resident should know when shopping for a supplement here. Number 1, the coverage is standardized by federal law. That means every company selling the base plan with a given rider combination is offering identical benefits. There is no better or worse in terms of what is covered. The coinsurance rider from Company A covers exactly the same thing as the coinsurance rider from Company B. Number 2, what does vary between companies is price and rate stability. The monthly premium and how much that premium increases over time is what separates one carrier from another. We track rate history and rate increase patterns across all the carriers we work with, and that information makes a real difference in which company we recommend. Number 3, your best window to enroll is the 6-month Medigap open enrollment period that opens when Part B starts. During that window, no carrier in Wisconsin can turn you down, can make you answer health questions, or can charge you more because of any health conditions you have. That window opens once. Once it closes, if your health has changed, getting a supplement can be much harder or more expensive. If you are finding this helpful, please hit the like button and subscribe so you never miss a video. Now let me talk about something that Wisconsin residents specifically need to think through, and that's what happens if you spend part of the year somewhere warmer. A lot of Wisconsin residents spend their winters in Florida, Arizona, Texas, or somewhere in the South. And if you choose a Medicare Advantage plan, you need to understand that the plan's network stays in Wisconsin. Medicare Advantage plans are built around local provider networks, and that network does not follow you when you leave the state. Most Advantage plans do cover true emergencies anywhere in the country. But here's the thing, emergency coverage is not the same as routine care. If you need to see your cardiologist, get a follow up after a procedure, manage a chronic condition, or see any specialist while you're wintering in Naples or Scottsdale, that is not an emergency, and your Wisconsin Advantage plan may not cover it at all, or may cover it at a much higher cost. PPO plans allow out of network care, but typically at significantly higher cost sharing. HMO plans often deny non emergency out of network care entirely. That's a real problem if you're gone for 3 or 4 months each year. This is exactly why most Wisconsin snowbirds end up choosing a Medicare supplement, and it comes down to one simple fact. A supplement works exactly the same anywhere in the country that accepts Medicare. There are no networks to check, no in and out of network calculations, and no need to call anyone before you go see a doctor. Whether you're at a clinic in Green Bay in October or at a hospital in Fort Myers in January, your coverage works the same way. Your premium is the same, your benefits are the same, and there are no surprises waiting for you when you get a bill. For people who spend significant time in another state, that predictability is a big part of what a supplement is worth. You don't want to be managing network questions when you're trying to manage your health. Medicare Advantage is not the wrong choice for everyone. There are people who are genuinely a great fit for it, and we help enroll people in Advantage plans too when it makes sense. But there are a few things you need to understand going in. First, plans vary by zip code and county. Whether your specific doctors and hospitals are inside the network depends entirely on where you live and which plan is available in your area. You have to verify your doctors are in the plan before you sign. Don't assume. Second, plans can change every January 1st. The network, the benefits, and the cost sharing can all look different at the start of each new plan year. What works well for you in year 1 may be meaningfully different in year 3. Third, switching back to a supplement later is not always simple. Once you're past your Medigap open enrollment period, going back to a supplement almost always requires medical underwriting, which means an insurance company can decline to cover you or charge you more based on your health history at that time. The longer you stay on Advantage and the older you get, the harder that switch can become. Let me give you a clear picture of who tends to be the right fit for each path. A Medicare supplement tends to be a better fit if you spend time in another state. If you want the freedom to see any doctor who accepts Medicare without worrying about networks, if you have ongoing health conditions that require regular specialist visits, or if you just want predictable costs and don't want the risk of a large out-of-pocket bill in a bad health year. A Medicare Advantage plan tends to be a better fit if keeping the monthly outlay as low as possible is your primary goal. If your local doctors are already participating in a plan available in your area, if you're in good health and don't use a lot of healthcare services, and if you want your drug coverage bundled in with your medical coverage. But here's the thing. These are generalizations and your situation is specific. When we sit down together on the call, we're going to go through your doctors, your medications, your budget, and your health history, and we'll find the path that actually fits you rather than the one that fits most people. Let's talk about Part D prescription drug coverage and how it works for Wisconsin residents. Part D plans are sold by private insurance companies, and the enrollment process goes through Medicare.gov directly or by calling Medicare at 1-800-MEDICARE. Insurance agents are no longer contracted to enroll people in Part D plans, but here's how we still help. We compare every Part D plan available in your zip code based on your specific list of medications, and we tell you which plan gives you the best coverage at the lowest total annual cost, including both premiums and copays. That comparison is something we do for every client at no charge to you. One change that made a big difference starting in 2025 is the out-of-pocket cap on prescription drug costs. Once you reach $2,100 in out-of-pocket drug costs for 2026, your Part D plan picks up 100% of covered drug costs for the rest of that year. That cap is a significant improvement for people who take multiple medications or any high-cost specialty drugs. If you're on a Medicare Advantage plan, your drug coverage is usually already bundled into your Advantage plan, so you typically won't need a separate Part D plan. Here's the one you absolutely cannot afford to ignore, and it's the one I see people get burned by more than almost anything else. If you skip Part D when you first become eligible for Medicare and you don't have other credible drug coverage from an employer plan or somewhere else, you will pay a late enrollment penalty, and that penalty never goes away. The way it works is 1% of the national base premium for every single month you went without credible coverage. That might sound small, but add it up over 10, 15, or 20 years of being on Medicare, and it becomes a permanent extra charge on every Part D bill you pay for the rest of your life. The penalty cannot be removed once it's applied. There's no appeal process that fixes it, it just stays. Even if you don't take any prescriptions right now, enrolling in a low-cost Part D plan at 65 protects you from this penalty. The cheapest Part D plans run just a few dollars a month, and that small cost is absolutely worth the lifetime protection it provides. If you're in Wisconsin and you're getting ready for Medicare, the best next step is to book a free review with us. Here's what that looks like. We'll go through your situation together, including your health, your budget, your zip code, and the doctors you want to keep. We'll compare every Wisconsin supplement option available to you with real current rates from every carrier we represent, and we'll explain exactly which riders make sense for your specific situation and which ones you can skip. We'll also compare any Medicare Advantage plans available in your county so you can see both options side by side and make an informed decision. If you're ready to move forward, we can get you enrolled in the same call. And if you're just in the research phase, that's completely fine too. We're here when you're ready. You can book your free Medicare review at the Calendly link in the description below. You can also take our free Medicare Clarity Quiz, which is also in the description, and it'll walk you through a few questions and give you a personalized recommendation for your situation before you even talk to anyone. Last but not least, you can always give us a call at 920-545-4884. If we don't answer, please leave a message. I will get right back to you. Our service is always completely free to you. We're licensed in Wisconsin and 45 other states, and we've helped thousands of people get this right over 16 years. Thank you, and we'll see you in the next video.